YouTube. As you can see, I'm sitting in a car other than, being at home. I just came back from my doctor appointment. I had an appointment to see my orthopedic surgeon and everything. And I kind of, don't like doing videos out in the public. Like that. But trying to get out of my comfort zone some. I got still a lot of work to do. But I just came from my appointment, and basically he, did say he was gonna do surgery, but he did say he mostly was saying that he wanted to try to hold out long as possible because my arthritis is so severe, and then me being young and all that, they put age with everything in it and stuff. So he was saying that and I was telling him about my sciatic nerve problems I'm having with that, and he said that he gonna schedule for me to have a MRI done on my back and set me, and when they get the results back from that, they're gonna, set me up for a treatment plan. He said something about some cortisones. I guess they'll start giving me cortisone shots in my back to try to help ease the pain with my sciatic nerve. But he said that if none of that help or help relieve any pain for me, then his next step will be to do the hip replacement surgery. I'm hoping that, it do give me some kind of relief and I can, wait it out a couple more years. Even though I am getting to a point where I'm kind of tired of dealing with, this leg. But I dealt with it this long. I can deal with it, I can go a couple more years, dealing with it and see. And, I thank him for his concern because, most doctors, some of them be probably go ahead with the surgery, But, he is, because even though I'm like, he put age with everything, he still being considerate, with my arthritis being as bad as it is. He don't want to do it now and then, and down the road, it don't last me or something like that. Because he was like, it might last me 5, 10 years or 15 years, if even that, or maybe longer, could be. But, I really appreciate his concern and, really telling me and explaining to me and stuff like that. And, I'm just, sitting around, it's more of a waiting game, he trying to watch it and see how it does and everything. Because I'm one of the younger patients that he, saw and, has been, start coming to him and everything. His office get packed pretty quick, so, I'm just gonna see how that goes. And, I hope that it, help give me some kind of relief with this nerve. Because this sciatic nerve is no joke. If you if you're not having a problem with your nerves or nothing like that, then, that's good. That's a blessing. But if you are, then you know just what I mean. And they had I was going back and forth to therapy. And then they had me to get an injection in my hip. And it on that shot on me lasted me for a couple of days, and then it wore off. That was all that I got out of it. And my leg, the therapy they can't really do exercises with, my leg and stuff to scratch the nerve because my leg is limited. Probably mostly due to pain or just stuff going on with it in general, I guess. So I'm limited, so they can't really do nothing to scratch that nerve. And he was moving it around and stuff like that, trying to see. And he was like, yeah, he even said that it's very limited. So I really can't do much with this leg. Both of my legs messed up, but the right leg seems to be worse than the left leg. But when I started out with arthritis and was diagnosed with it and everything, it started off my left hip. And then later on down the line, later years, it started developing in my right leg. And, it's in my left wrist and stuff, my wrist at the arm, because before I even went to him and he diagnosed me with arthritis, my bone was turned around in my left arm. So And I did ask, my orthopedic surgeon about my left arm, showed him and stuff. He was like, I still have a little motion in it. So, he ain't gonna do nothing about that right now, or check into that right now. And, what I was finna say? I forgot what I was finna say. Y'all, I forgot what I was finna say, y'all. Kind of nervous, just you could see my eyes wandering everywhere. I'm trying to get out my comfort zone and do videos. Like a lot of people do videos when they be out and about. I try to do it, but I had to try to be careful how I do it, because I don't want to be filming people, or, having people feeling like I'm filming them or feeling uncomfortable, and then, it be a mess or something like that. So I try not to, I had to try to be careful when I do try to, I try to trying to figure out a way to film out in public without it, being an issue to others, or that big old problem to others. I'm kind of, a little bit considerate of others, and I don't like filming people, like that. I don't like to be filming all that stuff myself, especially just holding a camera to me without my knowledge or nothing like that, So, you doing content and you ain't really trying to, that's fine, if I see you. But if I see you just like directly point that camera at me, or I feel or see that you doing something, besides content, then yeah. But so I get, how people can feel. And so that's why you don't hardly see me do much content and filming when I'm out and about. I might do a piece of a video and put it together, or do pictures and stuff like that. And what I finna say, though, I finna try to say about my arthritis. My arthritis, my doctor, they didn't tell me, but they got the patient portal where they put your information in. You can go in there and see, your information with all new stuff, update that they put in there. And I went on now on my page. I mean, page doctor portal, whatever whatever it's called, and to view my records and stuff. See what update that they put in there. And they said something about I had seropositive arthritis. That's the kind of arthritis I have, and mine is very severe. I have a very severe case of it. So if you don't know what that means, basically I have antibiotics in my blood, and it attacks my joints in other areas of my body. So that's what that does, and it causes a lot of other different problems as well. And like I said, unfortunately, I had that's a severe case. They got one called serum positive or something. That one will probably less severe, but the one I have is very severe, more severe than that one. So basically, I have to watch out for anything. I'm gonna have a lot of different problems going on with me and stuff like that, and pain and all kind of stuff going on. So yeah, I just have to try to watch out for, if anything happen to occur and stuff like that. So basically, he want to wait long as he can with the hip replacement, because if I get it now, even with my age and stuff, and my arthritis being severe as it is, and it's not the metal and stuff that they put in you, it don't last as long, don't last that long. So there's a chance that my arthritis can, damage it or do beforehand and stuff like that. So he want to try to wait it out long as he can, and I do too. And even though I'm kind of, like I said, getting kind of tired going through it. And I don't want to hold you in this video, make this video too long, but that's what I want to talk about in this video. And I'll see you in the next video.